Good afternoon, everyone. Welcome to our weekly webinar for unbelievably January 23rd, 2025. It's great to be back in this rhythm again of our Thursday afternoons. So thank you for being here. I'll remind everyone to mute yourselves, please, and to know that we are recording. And this recording will be available later today for future watching and rewatching. If you need the closed captioning function, look at the show captions button, which should be at the bottom of your screen, and feel free to enable that. If you have questions or comments while we're together today, please feel free to use the chat. I'm going to place a link in the chat for more information about today's topic. So do make sure you take a look at that link for more information about the CARE study. And that is our topic today, one of our newer studies that's currently enrolling and in progress at KU Alzheimer's Disease Research Center. And it's the CARE study, and it looks at unmasking the financial burden of Alzheimer's caregivers. I won't say any more than that because our speaker will give you all the details. Our speaker for today is Dr. Dinesh. He is an assistant professor of biostatistics and data science at KU, which means he does a lot of health policy research and has done and continues to do a lot of work with people experiencing cognitive change, including Alzheimer's disease, and including people with a cancer diagnosis and their caregivers. So we've got someone who's got a lot of knowledge on the data and the science side, and also a lot of compassion and care. So we're excited to hear about that. Dr. Dinesh, it is all yours. Thank you so much for being with us today.
Thank you so much, Kelly. How is everybody doing? I hope everyone is staying warm, and hopefully we have all our cold weather behind us. I'm looking forward to the nice, pleasant spring here very soon. So I'd like to take this opportunity today to talk a little bit about what financial burden or financial toxicity is all about. As Kelly had mentioned, I'm a health policy researcher by trade. I have a slightly multifaceted background and skill set. I started as a computer scientist and developed softwares technology. I still oversee some of the technology here at the KU Medical Center. But then quickly I pivoted into research because research excited me and I wanted to create an immediate impact with patients and caregivers. So that's what led me to pursue a PhD in health policy and management. And as part of that, I've worked with cancer and Alzheimer's patients. And my main area of research is focusing on trying to develop intervention to mitigate financial burden. And financial burden is very common, both among Alzheimer's patients and caregivers, but also among cancer patients. My track record so far has been with cancer. So this is my new territory where we are trying to explore as there are new treatment that we are actively working on and trying to get it into the market. Being prepared on how to handle the financial burden is going to be very important. So oftentimes financial burden is perceived in or it's classified into two categories. One is objective financial burden and the other is the subjective financial burden. What is objective financial burden? So objective financial burden very often is the direct impact on the finances of a caregiver. So this could be in many forms. This could be depleting their savings, depleting their assets, or even loss of job, loss of income, because as a new caregiver, one may have to take time off or completely give up their work or take an early retirement. or even cut down on the hours they have been working. So, and then there are a lot of cascading effects due to this objective financial burden. And one of the common things is when I've done studies previously, I've noticed talking to caregivers and patients that they oftentimes don't realize that when they take an FMLA or even apply for a longer leave, or if they reduce the number of hours, quickly they start losing the benefit, the employer benefit that they have. And insurance is one of the primary key benefit that they typically get through their employer. And so one of the studies we have done in the past is trying to educate patients and caregivers on how to keep up with the bare minimum number of hours so they don't lose these benefits. And that would reduce some of the financial burden. And now, when I come to the subjective financial burden side of things, the stress, the difficulty in paying bills, the concern of future, and the financial satisfaction. So these are mostly the scare uh, due to the actual objective burden. How am I going to plan my future? How are my children's going to be impacted due to the financial pressure that we are going through? And then that all of this impacts quality of life, and then it also leads to many other unnecessary health related issues and mental stress. So, as part of this care study, what we are trying to do is we are trying to uncover the factors that really contribute towards the financial burden. So, this is a two-part study. Um, in our ADRC recruitment and outreach team is helping me recruit participants for this study. And so when I said there are two parts to this study, in the first part, we are trying to conduct a qualitative interview with the caregivers. And these interviews are typically just 30 to 40 minutes where we want to learn through your experience as a caregiver. What are the things that have contributed? Did you have any work impairment, or was there anything um, due to additional costs that you have now you have incurred that you did not plan for? And these costs could be as minor as transportation, because um, with the appointments and other aspects, now you have to drive your loved ones as a caregiver to the appointments and also take them to other things, right? So that is an additional time that as a caregiver you're investing. It is anticipated that a caregiver as of 2022 spends time which is valued at $340 billion. So it's a huge time investment. When you convert it into a dollar amount, it's a huge investment. So again, we want to understand, which will then lead us to develop interventions. So I'm going to share two things here. One, the first thing is going to be about the Care Assist app. If you haven't already seen, this is a mobile application that the KU Alzheimer's Disease Research Center has led. This was released last year, and this provides some information for assistance. This is not directly related to financial assistance, but we want to add a module down the road based upon the study that we're doing now to then find out, by answering few questions, we want to pair the caregiver to some of the local financial assistance resources. And in the area of cancer, you will start seeing there is a new role that hospitals and clinics are implementing called as financial navigators. So, we want to come up with a technology intervention, or more like an hybrid intervention with technology as well as human touch to it. But that's our goal. So, what we are doing now with this study is going to eventually lead to a module that we will be deploying into the same Care Assist app, that will connect caregivers directly with the resources that are locally available. So, and hoping that will help them find the assistance that they're looking for to address some of their bills and mitigate some of their financial burden. So with that, I'm going to throw our flyer for this care study. And if you haven't signed up, and if you know someone who's a caregiver, we would love to connect with them. And there's a barcode here. You could just scan this, and it's going to take 15 to 20 minutes to complete 4 different surveys. Once those surveys are completed, our study team will screen individuals and contact them for that first part of the study, which is an interview for 30 to 40 minutes. So that's all I had to talk about today, and I'm happy to take any questions.
Thank you, Dr. Dinesh. We're so excited about this study. We're excited about all kinds of studies, of course, because every bit of research gets us closer to treatment, cure, prevention. And this caregiver study is especially important for that because we're getting real data, right, and real feedback from people hands-on doing direct work. So it's very exciting to think about having this study here at KU. I know you mentioned in the flyer and in your talk and in conversations we've had that there are interviews. Can you say more about how people might be able to do interviews should they decide they want to maybe try to participate in the study?
Yeah, great question, Kelly. So our study team, what they do is they screen, they find out if they are eligible, and then they drop an email or call them based upon the information that is completed using this barcode. And we try to find a time that works for them. We could pick and choose any time. It doesn't have to be during the work hours. It could be also in the evening hours if that is feasible. And the interviews are done completely remote. It's through either Zoom or a phone call. And we go through a semi-structured interview. There are roughly around 15 to 18 questions where we are asking about um, the hours that are spent as a caregiver, what impact they have had on their finances, and some of the coping mechanisms that they have adopted. So all of this provides a holistic view for us to then start thinking from a policy standpoint, what are some of the state and federal policies, and what are some of the resources that could help develop intervention that can mitigate their financial burden.
Okay, so it sounds like it's really accessible to people. People don't have to or don't get to come to KU necessarily to participate, right? They can stay home if necessary. Is this study open to people who might live somewhere completely different, not in Kansas, not in Missouri?
Yeah, this study is open for anybody across the globe, I should say. But we are more interested in folks here in US because our health system is completely different compared to other countries. So across the nation, the study is available, and they can complete this survey on a mobile phone, or they can use a computer to complete it. But as I said, there are 4 surveys, so it's not just a simple one survey thing, because all of this data that we are collecting through the survey will also be used for the second phase of the study, which is a quantitative aspect of the study. So it's a mixed method kind of a study, So both the interviews and the survey data will help us inform about the factors that contribute directly into the financial burden.
Very good. Okay. I know one question that comes up a lot is, and we can see the study criteria, the who can participate, and we see, people have to be 18 or older, and you're looking for people who are somewhat new to being caregivers. How does someone know that they're a caregiver?
Well, if they're living in their home, if they're living in the same household and trying to help their loved one, and this loved one could be their partner, their spouse, or their parent or in-laws, and if they are helping them with their day-to-day activities, or their whomever they're giving care to or providing care to has had a diagnosis of dementia. All of these would qualify them to be a caregiver. There is a wide spectrum of caregiving, so we are not limiting for this study on if they are a full-time caregiver or a part-time caregiver, or if they're only helping with some administrative stuff because their loved one has just been, um, you know, in their early stages of dementia. Again, we're trying to capture maximum variation across the population at this point, and then this will then lead us to focus on the most vulnerable caregivers, and then start from there on developing intervention, because an intervention that works for the most vulnerable population will eventually work its way for everybody, and it can be generalizable.
Very good. So it sounds like a self, I was going to say diagnosis, but that's not quite right. Self-identification, right? Maybe
Yeah,
as a
yeah,
caregiver would
yeah.
work. And we have a
And
question.
even when they complete this survey,
Mhm.
it also helps us determine if they are eligible or not. So that's why as a first step, we recommend if they can take the survey, that will automatically trigger the next steps.
Perfect, perfect. So go ahead and fill out the survey is what I'm hearing,
Yeah.
if you're interested, and we will definitely find out more. And the great thing about filling out our surveys for research is that you might be eligible for this study, let's say, for example, and there might be another study that would be a good fit. And filling out the survey and being thoughtful and generous about someone's time is always something we really appreciate. And it might be that you're a good fit for some other information that we would like to know. Everything in this study is confidential, right, Dr. Dinesh? You're not going to
Yeah.
publish a list of what people are doing attached to their names, right?
Yeah, we are following all the HIPAA criterias, and what we do is when we uh, analyze and publish, and nothing is published at a record level. Everything is going to be accumulative, and among the participants, we will also include one or two participants in the publishing process, and we have been doing this over the last 4 years because that keeps us very transparent in our process and ensures that I'm not articulating something extremely opposite to what the participants in the study have noted. So that just brings a flavor of actual participants' view as well when we are trying to publish.
Perfect. Okay, we have a question in the chat,
Uh-huh.
and I assume this is for you, Dr. Dinesh. Are you a caregiver?
So I used to be a caregiver. I'm not a caregiver now, but around 10 years ago, I used to be a caregiver, not for a dementia patient, but for my uncle who was disabled because he had a stroke, and he's no more. But I have had a caregiver experience, but not for very long, for I would say roughly 2.5 to 3 years. But I did realize there wasn't a lot of guidance or anything like how I would prepare myself for that kind of a situation. I was thrown at it, and there were no one else to help him out, and um, I just did it because my wife was okay with that.
Yeah, caregiving really is a family experience so often,
Yeah.
isn't it? You got somebody with a diagnosis and then a whole team
Yep.
who can participate. So that's good to know. Let's see, there was something else I had thought of to ask. Thank you. Our chat person in the chat has thrown out another question. What have you gained from this chat? So just from preparing for today, Dr. Dinesh, and telling us about the study, do you have any new thoughts about what you might be looking for? I think I'll add to that question. How has giving this information been helpful? I hope it has been for your study work.
Yeah, I should have also mentioned we have successfully already interviewed 8 participants so far. I won't go into too much details because we got to do a thorough analysis, and then I'll be happy to bring back the results and share it with this group as well. But it's been a complete different contrast. Even though I've had a limited caregiving experience, I haven't had to quit my job to do that. I did not have to take time off. I did not have to drive my uncle as a caregiver to various different places. But and on a positive note, looks like Medicare and Medicaid has been covering some of the cost for these um, participants who had participated so far. So again, I'm open. As a researcher, you got to keep your antenna up all the time and try to absorb as much as possible. And then you make an informed decision with all this information that you gather, right? So I'm not narrowing my thoughts or my ideas yet. But as I said, you start broader and then you identify these hotspots, and then you start thinking about an intervention development.
Yeah, and isn't that really the gift of all research, right?
Yeah,
We learn what we do know and what we don't know,
yeah,
and where we can also sort of direct our next thought. So this is really exciting. Thank you, Dr. Janesh, for sharing with us today. I want to make sure if you've come into the meeting today in the last few moments, I'm going to repost in our chat the link to the more information about possibly participating in the CARE study, as well as how to get to the Care Assist app that Dr. Dinesh showed. I am completely biased, but I happen to know, not just think, but I know that app is really very useful. You can use the app on whatever kind of device you have, right? An Android or an Apple, and it's really set up for looking for a specific question that you might have about behavior or communication, like bathing or eating or dressing, and you can use the app to find some pretty good guidance. It's totally free to use and to download, and I think it will have updates ongoing. And if
yep,
anybody out there is knows a Spanish speaker, it is also available in Spanish because, of course, we recognize that this disease affects all kinds of folks. So any other questions that our speaker can answer for you, please feel free to put those in the chat or unmute yourselves. How long will this study be going, Dr. Dinesh?
So we are targeting for 20 interviews. So we are right around 8 to 10 at this point. So we still have time, but the study is anticipated to end by July of this year, and we hope to recruit and try to conduct all the interviews before that. So I also see there is another question. What is the purpose of this presentation? So the main purpose of this presentation was one to, spread the word about our care study, what we're trying to do, and then how this could lead to eventually interventions that we may develop. And as I said, with Alzheimer's specifically, we are actively working on medications and testing the medications and the treatment. So we are trying to be a step ahead and making sure that once those interventions and medications are being offered and delivered, then you know, if if we cannot provide that medication to everybody, then we defeat the purpose of having a medication, right? I keep hearing that all the time when I'm working with the cancer patients who say, "Oh, I don't have insurance. I've been turned down from treatment, or I was referred to another hospital completely." So it's heartbreaking to hear those stories, and so we just want to get prepared on the Alzheimer's standpoint.
Exactly. Well, thank you so much. Anybody have any other questions you want to have in front of the group? We've got about 3 minutes left. Please do go after those links that I said I was going to repost and I didn't do it yet. I'll put that in the chat again. Please take a look at those and click them. I think I mentioned last week, we've set up some of our links so that we know that you clicked on them because you watched this webinar live. So we'll know exactly how many people saw this and thought, yep, I'm going to check it out. And that's good for us to know what our reach is. So I just put the new link or the link again in the chat. I just thought of the other question I wanted to ask Dr. Dinesh. And I know that this study is, you're asking for people who are relatively new to caregiving as opposed to maybe those who have done it for a longer time. Can you speak to why you made that distinction?
Absolutely, absolutely. So I kind of touched upon this earlier, but um, um, the main purpose, and there is some literature around this, is caregiving is a new role altogether. And there isn't formal training or formal like a manual, user manual that one could just use and get themselves up to speed on what to do, how to do. Most of it is currently through some of the support groups, right? That's where people are sharing what they have gone through, how they handled a situation. But um, there isn't a right answer for some of these things on how you do it, but also there isn't a lot of information out there on how can one be ready and prepared. So what we are noticing is because of that, in the early periods of caregiving, most caregivers experience a lot of financial hardship. So we're starting with that. Again, you could see the inclusion criteria. We said 15 to 24 months. We have a little bit over 24 months would also be fine. But that's where once we get that survey, we are making sure whomever we interview is eligible based upon the IRB criteria.
All right. Well, thank you again, Dr. Dinesh. We are very excited to have folks enroll in the survey and also excited to hear what you learn. And so you all heard Dr. Dinesh say that he would be willing to come back and give us an update. This is recorded, so we'll hold him to that. I'll be in touch whenever you're ready to give us an update. For everybody else, I will tell you that our speaker next week is someone I've known for several years and have worked with before. She is Dr. Brandy Archie. She is an occupational therapist, and she's going to talk with us next week about accessibility and home safety, particularly for people experiencing cognitive change and for their caregivers and for people with disabilities. So she'll give us some really great insight onto how to make sure things are safe environmentally and physically and probably even emotionally when you are in one or more of those categories, being a caregiver, receiving care, having a disability. And the truth is that all of us will probably find ourselves in one of those roles or more at some point. So that's next Thursday, January 30th with Dr. Brandy Archie. You'll see more information about her in Monday's My Alliance newsletter. And I will also say that just before this program today, I was working on the brain booster for next week, and I'm just having such a good time with it. So I hope you will too. All right, everyone. Thank you. Have a great rest of your day, and we'll see you next week. Bye-bye. Thank you, Dr. Dinesh.